Welcome to My Business Matters, the Michigan Chamber podcast.
Hello, I am Becky Burtka, Vice President of Member Engagement for the Michigan Chamber and today's podcast host. Today we're talking about something that most leaders are dealing with, whether they say it out loud or not, how stressors or mental health are showing up at work, and what effective leadership looks like in that environment. Our expert is Julia Isaacs, who leads behavioral health strategy and planning at Blue Cross Blue Shield of Michigan, and she'll be helping us talk through what's changing in today's workforce and workplaces, where leaders struggle most, and practical ways to support your team's mental health and lead with empathy while still delivering results. So let's get right to it. Welcome, Julia.
Hi, Becky. Thank you so much for having me.
First of all, I just want to say you did a fantastic job on the webinar that we recently had through Michigan Athena, and I just really appreciate you spending some time with me today as we dive a little deeper. You had great answers, so anyone listening, I totally recommend that you check out that webinar on YouTube. But just really, really grateful to have you and your expertise. You truly are an expert in this field.
Thank you. This is probably my some of the most conversations I get to have when we get to talk about mental health in the workplace because I live it every day.
That's awesome. Well, let's get to it. So, mental health in the workplace, it is being talked about more now than ever, and a lot of leaders really still aren't sure what that actually means day to day, or sometimes they're a little uncomfortable with it. So, from your perspective, why is this issue showing up more prominently now, and maybe especially for employers?
So I think that we all, had a pretty bright spotlight shown on mental health during the pandemic. And I think if you hadn't thought about it before, or maybe, employers hadn't thought about it as acutely as they had before, they certainly think about it and continue to think about it kind of post-pandemic in the workforce. So I think that really helped, I will say. We got a lot of questions around the pandemic, but we had seen more and more employers talk about mental health, be more interested in what mental health services were available for their employees. So it's certainly showing up more since COVID. But I also think that there have been a number of studies across the country around companies and productivity, and really a keen acknowledgement that mental health does have a negative effect if it's not well treated in the workplace on productivity, on absenteeism, and a number of other ways that can hurt the company. So I think from that perspective, employers have really embraced how do we find better ways to support our employees, and are really interested in talking about that and having more conversations about mental health in the workplace.
That's so interesting. I feel like sometimes we think about the pandemic as being so far gone, but then sometimes it feels like it was just yesterday, and that we're still learning so many things from that period of our lives.
Yeah, and I think, it wasn't like we didn't have concerns about mental health. It wasn't like mental health conditions didn't exist before the pandemic. We've had double-digit increases kind of year after year, but I think during COVID, everyone, if they didn't feel it themselves, they felt it from a loved one around them. Mm-hmm. And so they really got to see, I can see how this, would affect people that I care about and employees that I might work with.
Yeah. So leading with empathy then, right? If we're talking about mental health and empathy, it can sound sort of vague, but in practical terms, how would a leader lead with empathy, and what does that look like in today's professional environment?
So I talked a little bit about this on the podcast earlier this week, but I think it's really important that we understand what empathy is, right? Empathy is the ability for anyone to walk with somebody in their experience. It doesn't mean that you necessarily do that experience, right? A CEO can be empathetic to, if they're very far at the top and somebody's just a kind of a line worker at the bottom, you can still be empathetic and work to understand what that experience would be like for somebody. So I think a good leader, if you're leading with empathy, it means that you listen and you understand the experience that another person might have. It's not that you feel bad or feel terrible that they had to go in on a holiday and you feel sad. taking a moment to actually understand and think about what would it be like if that were me, and what would I want someone to tell me or talk to me about, is really how you be a good leader and be an empathetic leader. It's challenging, right? The farther up that you get, if you are a leader, to really take the time to understand. But hard decisions have to be made in a business that can be, challenging for the leader, but can be really challenging for that employee. So trying to take the time to understand and hear and listen is really what I think being an empathetic leader really means.
That's so insightful, and I think something that you did also talk about on the webinar, which I'm wondering if you could give us just a little sneak peek or a preview of that, is the difference between empathy and sympathy. And you kind of alluded to that a little in what you just mentioned, but what is the difference, and how can you be more empathetic, but not necessarily, what I guess then what is the difference between empathy and being sympathetic?
Yeah, it's a great question, and I think it gets really tricky, right? Sympathy is where you are feeling bad for someone, right? You have sympathy because something bad has happened to another person, and you're like, oh, that is terrible for that person. Empathy is when you seek to experience and understand and walk with that person and what that experience might be. So if a challenge happens in the work environment, and, I'm just giving, some hypotheticals here, and there's some, major change that needs to happen, and restructuring needs to happen in the organization, and maybe an employee is moved under a different space, you could feel bad and say, that's terrible. That must be hard because that's a big change. But if you're empathetic, you seek to understand how might that person feel about that change, right? And walk through the actual experience that that person might have to better understand what it would be like, opposed to just saying, oh yeah, that's too bad. So it's a little bit more in depth in terms of looking at putting yourself in somebody else's shoes and seeing that from that perspective, because everybody's perspective is different. So when you make a change as a leader, yes, you can feel bad you make that change, but take a moment to kind of put yourself into their shoes, and what might it look like from their side, right? Mm-hmm. Because it could look very different from a leader's perspective. We're just doing this because we got to be more efficient and we have to this, but what would it look like to that employee? If you're being really empathetic, you could say, this could feel really abrupt to them. This could make that employee feel like they did something wrong, or their performance wasn't good. And it might have had nothing to do with that. So taking a moment to kind of dig a little bit deeper can really make a difference and show that you are being empathetic instead of just sympathetic.
That's great. Thank you so much for that. So, I think many leaders say that mental health conversations feel different with younger employees maybe than they did earlier in their careers. What differences are you seeing, and what should leaders understand about that shift working with multiple generations in today's workforce, which we know is the most generations in one workplace that has ever been? So we have the most diverse workforce from an age perspective. Yeah. How do we navigate that?
So I do think that we see, more normalization of mental health and mental health concerns being voiced and discussed in the younger generations. In a lot of ways, many employers have taken the time to kind of try to reduce stigma associated with mental health and mental health conditions, reduce stigma associated with getting treatment for mental health conditions. We do see that there's more discussion and more normalization, again, of those conversations amongst the younger folks. I see more younger individuals saying, I need a mental health day, right? And they're comfortable saying that in ways that even 5 years ago, certainly 10 years ago, people never would have said, which is great. If you're not feeling well, you need to take time. You have time that you're allowed to do that, and voicing those concerns and saying, I'm really stressed out. I'm really struggling today. So we do see some generational differences in that. I think across the board, we've seen reductions in stigma associated with mental health and mental health conditions. The prevalence rates for mental health conditions are really pretty astronomical, right? 50% of everybody at least will develop a diagnosable mental health condition within their lifetime. So it's more prevalent than most medical conditions that we talk about pretty freely. So having the ability to have those conversations and acknowledge acknowledgement that these are very real conditions that happen in the workplace and in our personal lives, I think has been really helpful.
Wow, 50%. That's wild. Thinking about leaders and how you become a leader, how you develop in leadership, I'm just kind of curious, is empathy something that you're born with, or is it something that can be taught through leadership? Is that a quality that people just, you're a natural born leader and you just get it? Or is that a muscle that we have to build and then, use and flex?
To be fair, I think there are probably people that are more natural at empathy, that it comes more naturally to them, either because of the way they were raised or just the experiences that they've had in their lives, or even just their personalities. But it is certainly something that is certainly a muscle that you can work on. Even very empathetic humans, people that really do kind of feel, are not always great at expressing that empathy. So I think those are also two different things. So the first thing is, are you able to step back and put yourself in somebody else's shoes and think about what that experience might be? And the second skill that very much can be worked on is, how do I actually communicate that to other people? How do I communicate that I am listening and that I am hearing them and that I am taking the time to understand what it's like to walk with them in that experience? And it can certainly be something that you flex as a muscle to work on.
Yeah, totally. I love that. Because I think leadership is such a journey, and it's a bouquet of skills and opportunities, and to know that can just be another piece that could be added to that. Leadership dynamic is important. I think hitting on that communication, right? That empathy needs to be communicated, and that you need to learn how to communicate it in that way. Maybe if it doesn't come naturally, is very important.
Yeah, I think people have different levels of comfort with that communication, right? So I think trying and, the more you do it, like anything, the better you get at it and the more comfortable you are in that space.
Yeah, for sure. So kind of a touchy question, but something that I think we all struggle with as leaders is, what happens when deadlines are tight, but performance still matters? So we are coming up on a big project, and how do leaders adequately or professionally show that empathy without lowering expectations or sending mixed signals to their teams, keeping that level of excellence up?
Yeah, I want to make sure that everybody understands that I don't think in any way those two are in conflict. I think showing empathy does not mean in any way I have very high expectations for my team. And part of being empathetic is them knowing that I have very high expectations for them, because I respect them and I respect the work that they do. So I think it's tricky when there's tight deadlines, right? You don't always have the time to sit down and say, this is the decision that I'm making and this is why, and walking through it in those time frames. So I think one is like setting the foundation for when we do have those tight time frames, right? So you can't be, non-empathetic in the entire year, and then we have an end of the year push, and then and try to make time for empathy, because there are times when we just don't have as much time to sit down and do that. And so building that capability and that understanding of the team beforehand, I think, is really valuable, so that when times come and it's short, right, we don't have time to have this discussion of why we're making this decision. We need to pivot right now. We need to get the work done. People will already have that understanding that we know that she's doing this because it's got to be done, and she must have our best interest at heart. So I think that's the first thing. The second thing is, you can say, hey, listen, you guys, being really clear, I don't have time. We don't have time. We have this huge push. We need to work through this right now. And then you can, but I'd be happy to talk about it later and process this at a later time, because there really is not always enough time to do that work in the moment. And being able to say, listen, we got to get this done right now. We got to move forward, and we can kind of talk about what this means and what our experience was at a later time.
Yeah, clear is kind, right? I hear that all the time. And building that rapport and respect with your team, and then being able to maybe pull from that bank in times of, great need. Makes a lot of sense. So totally get that and appreciate that insight. So kind of thinking about actionable takeaways to our audience, to folks that are listening, what is maybe one thing differently next week? An actionable item, not necessarily a full culture overhaul, but a realistic step that someone can make to make a difference, to move more towards being an empathetic leader or building that rapport with their direct reports.
Can I do two things really quick? Is that okay?
Absolutely.
So the first thing I would say is just making sure that you do a check-in with yourself and where you are and what you're bringing to the workforce. So I think that gives us an incredible amount of insight into how we show up for our teams, how we show up for our colleagues at work, because knowing yourself helps you know other people. And then the second thing that you can do almost immediately is take the time to check in and ask folks how they are. I'm sure you hear this all over the podcast, Becky, but we have a tendency to kind of get right down to it, but asking an open-ended question about, what's going on, are there any things that are getting in the way of the work right now that you're doing, can be, I think, two things that can really put you on a pathway to be a more empathetic leader.
I like that. As you were talking, I was thinking about something that we do at the Michigan Chamber. Before each meeting, we start with good news, and everyone goes around and they share good news. It can be professional, it can be personal, but it definitely kind of sets a good tone, a positive tone for the meeting, and you're free to share something, maybe from home, that kind of gives people, that fuller picture of you. But I think that does kind of drive more at being an empathetic team, and connecting on a different level too. So I like that.
Absolutely.
Yeah. And
absolutely. That's great.
Connecting with yourself, right? Because if you're not well, for all intents and purposes, then it's really hard to lead a well team. So, kind of thinking over that, just maybe one last question, since you did talk about making sure that, or I guess we talked about being an empathetic leader and leading a team, but what does that look like to lead yourself, and make sure that you're showing up whole and happy and healthy? And we don't, we're human, and women especially feel like sometimes we just have the emotional weight of the world on our shoulders. But how can women protect some of that mental health and well-being when they're coming into the workplace? And you said managing yourself a little bit, but I'd love if you could expand on that.
So I think doing a purposeful and very deliberate check-in on yourself, I think as women, as you said, we have a tendency we got to get it done, go, and then we got to do things after work, and we got to do this. You really do need to set some time to explore how do I feel, both kind of mentally, what am I thinking? Am I overwhelmed? Am I stressed? And then also taking time to, how does my body feel? So we have a tendency to move through the day with headaches and hunger and distress, and not understand how that is affecting us, and then subsequently how that's affecting individuals around us. So checking in on yourself, and then it's always this, we don't have time to self-care. We don't have time for, you can find 5 minutes, because I know that if one of your team members came up to you and said, can I just have 5 minutes of your time, or your family, you would find that time. So finding that time, making that time, doing something that is brief and related to self-care, taking a walk. I mean, right now it's raining outside, so I wouldn't take a walk. But you can take a moment, and so not giving yourself any excuses not to take those moments, because they really are critical to your well-being and your self-care, and your ability to show up and do your work and be the best person that you can be.
That's awesome. Yeah, I mean, remembering that you're a human too, right? And I love that you said, if your teammate asked that of you, you would give it. So you need to give it to yourself, because you're your number one teammate. Mm-hmm. That's awesome. Well,
absolutely,
Julia, this has been great. I loved, hearing everything that you and your panelists had to say on the webinar, and now to just take this a step further and have another conversation and just dive deeper into everything that you know about well-being and wellness, and a great partner with Blue Cross Blue Shield. I'm just so grateful that you were here today. So huge thank you to you as, we work through those insights and how a few truly intentional actions can go a long way. But also want to thank the listeners and coming on that journey with us and potentially checking out that webinar. I think that's a really good next step. So, if you found this episode helpful, be sure to subscribe and share it with a colleague who may be navigating some of these challenges, because we all are, as Julia just said, and we'll see you next time. But subscribe and like to our podcast for easy notifications.